and I'm really excited because we've got Dr. Stuart Lee, who is the chief of neurosurgery, medical director of the Gamma Knife Center at ECU Health here in the studio this morning. We're going to talk about the Gamma Knife. We hear about that, but what is it? Nobody can figure it out. So we got to get Dr. Lee to tell us, and it's good to see you. How you doing?
Good, thank you.
Thank you for coming in.
Me.
And we were just talking about your background. You were in the first ECU medical school class.
Yep, I was in the first 4-year class. Actually graduated here in 1981.
And I was just asking you about your path because most people come and go through and are going to be in family medicine, but you took a detour.
I did. I actually came to medical school with the idea I was going to go into family medicine because of my family doctor. I grew up in Smithfield, had a kind of country doctor. And he's actually why I wanted to become a doctor. But I got interested in the brain and nervous system when we took the neuroscience, neuroanatomy classes, and started following the neurosurgeons here around and led to a different path.
And I got to say that Dr. Lee is one of the tops in the field in the country. He's done an unbelievable job here. So thank you for your hard work here. You and I were just talking about, you don't talk about who your patients are, but I was telling you about some of my friends who've been your patient that just rave about you.
Thank you.
Okay, let's talk about Gamma Knife. What is Gamma Knife?
So the first thing, and we try to clear this up with patients, there's no knife. So the Gamma Knife was actually—
Bad marketing, right?
Right, exactly. The Gamma Knife was invented by a Swedish neurosurgeon in the late 1950s. It's come a long, long way since then. But the point is he wanted to think that it's a type of radiation that's given to a very small target with very significant accuracy so that there's very little radiation to the surrounding brain. I tell patients it's like hitting the bullseye of a target with very little radiation to the next ring of the target. And that was what Dr. Lexell, who invented it, wanted it. It's the precision of taking something out surgically, but without having to undergo surgery.
So when do you use it? I mean, you don't use it on every cancer patient.
No.
When is it appropriate?
So most of the time it's tumors that are relatively small, 3 to 3.5 centimeters or less. About half of our patients are those patients who have cancer, lung cancer, breast cancer, et cetera, melanoma, who have cancer spread to the brain. And historically, they would get whole brain radiation before technology like Gamma Knife came along. Whole brain radiation is exactly what it says. Your good brain gets radiated with the tumors. Gamma Knife spares the normal brain. So about 50% or so of our patients, maybe 55%, are patients who have metastatic cancer. The other patients have benign problems, but we try to spare them an open surgery, so it's used for benign tumors like meningiomas, tumors that grow from the covering of the brain, certain vascular malformations of the brain that are generally congenital, for a pain problem called trigeminal neuralgia, a very severe facial pain problem. We put a lesion in the trigeminal nerve. So about 45% of patients don't have cancer. They have benign problems in the brain. But as cancer patients live longer than they used to, more and more of them are at risk to develop metastases in the brain. So we find ourselves doing more Gamma Knife on patients who have cancer. So.
Do you use Gamma Knife on cancer patients other than the brain?
No, the Gamma Knife is purely a technology for the brain.
Right.
We have another technology at ECU Health called CyberKnife, which was also invented by a neurosurgeon, but it can be used for lung, prostate, and since we have both technologies, we tend to use the Gamma Knife for brain lesions. It's actually slightly more accurate than the CyberKnife.
Right. And am I right about this? ECU Health was the first in the state to have Gamma Knife?
We were the second. Wake Forest had the first, a few years ahead of us, and we're still the second. Actually, Atrium Health in Charlotte is installing a Gamma Knife. We were actually the first in North Carolina and actually the first in Virginia, South Carolina to get this newest version of the Gamma Knife, which is part of what we're trying to let people know about, called the Esprit. So we got the first Gamma Knife here in 2005. We're now on our 4th model. And a lot of it, if you look at the actual guts of it, if you take the pretty cover off, it looks very much like Dr. Lexell's 1958 prototype. But what's changed is computer technology. So the technology that lets us treat patients quickly, accurately, plan it quickly, is light years different than the original.
And my notes here from Ashland say you've recently done a software upgrade to it, right?
We actually did the software and a bit of a hardware upgrade. We replaced about 50% of the machine. Went from a model called Icon to a model called Esprit, and that's the thing. We're the first around here to have that. But it lets us plan the treatment more quickly. It delivers the patient more treatment more quickly. I actually did one earlier before I came over here. The patient's treatment, she had a recurrent small tumor the treatment time was 6 minutes. And so,
Wow.
and unlike conventional radiation where people are used to going day in and day out, maybe 15, 20 treatments, most of the time the Gamma Knife is done as a single treatment. There are a few occasions on certain tumors, if they're near something like the optic nerve or the brainstem, very important structures, we might treat them over 5 days, but most of the treatments are single treatments. So very different than what people think about as conventional radiation.
If you're just joining us, so we've got Dr. Stuart Lee in the studio with us, the Chief of Neurosurgery and the Medical Director of the Gamma Knife Center at ECU Health. How many cases have you now done?
So since we installed the Gamma Knife in 2005, we've done about 2,700 cases. We do about...
So you use it a lot.
We use it a lot. We do between 200 and 250 cases a year.
Right. And you've talked about some of the benefits of it. I guess, again, it's a more... you can zero in on the tumor rather than destroying good cells.
Correct.
Is that the main?
That's the biggest advantage, is that you're treating the tumor and preserving the surrounding brain tissue. The other advantage is that there's really no downtime. So for the lady I did this morning, she goes home, there's no downtime, she goes back to whatever. I literally have had a guy, we called him the day after, we treated a tumor called a vestibular schwannoma. It's a little tumor that comes off your hearing nerve from the brainstem. We called the next day to find out how he was doing. He was out on his bulldozer. So there's no downtime like we think of for conventional open brain surgery.
So without this, somebody like that would have you'd have had to cut his head open.
Correct.
Right?
And the alternative would have been a surgery that he would be in the ICU for a couple of days and be in the hospital probably a week, and a 6 to 8 week recovery. So very different.
I'm always amazed at the things that are going on right across the street from us here.
It's actually pretty amazing.
Yeah. And you're amazing.
Oh, thank you.
Thank you. The fact that you've become one of the top folks in the country using this Gamma Knife is pretty interesting. What else have I not asked you that you want to mention? Is anything else?
I think that's mostly it. The one thing I would like to leave people is it, like you said earlier, it's not for every brain problem. It's not for every brain tumor. We pick and choose. We actually have a conference every week where there are neurosurgeons, radiation oncologists, neuroradiologists, neuro-oncologists. And again, that just shows you the talent we have here. We have the only neuroradiologist east of Raleigh. We have the only neuro-oncologist east of Duke. But anyway, we all get together and discuss cases. So every case is presented at that conference so that Dr. Lee or Dr. X doesn't just decide this is what we're going to do. It's decided by a multidisciplinary team. So there's a lot of input that goes into every single case.
When I hear stories like this, and you must feel the same way, having been in the first class at ECU Medical School, I think back to the vision of the medical school that Dr. Jenkins had. Leo Jenkins had this vision, and when I hear you talk about what's going on here and the cutting edge technology that you're using and those things like that, I mean, it just makes me number one, I'm in awe of it, but number two, I'm so proud of what has happened here with people like you and what's happened at ECU.
No, I agree. I'm very proud to have been in the early days. I can think, we were much different then. There were 28 people in our class.
My wife worked with you.
Your wife was a nurse, exactly. And, Dr. Jenkins would have us over to his house. That's how much the medical school meant to him. And, you think from there to where we are now, it's truly amazing.
Yeah. Well, thank you for all you do. It's great to see you again.
Thank you.
Yeah.
Thanks for having me.
And this has been fascinating. Dr. Stuart Lee, the Chief of Neurosurgery and the Medical Director of the Gamma Knife Center. I hope I'm not in there using it, but I'm glad to know that you're here to do it if I need it.
Thank you.
Good to see you, Doc.